Today, we are pulling back the curtain on a multinational investigation that uncovered three really mysterious companies. These companies are sitting right at the heart of the U.S. healthcare system, and they're allegedly helping corporate giants siphon off tens of billions of dollars, money that should be going to health plans, and ultimately to patients like you and me.
So our story kicks off at what you'd think would be a bustling corporate headquarters, but instead we're at an empty office in a suburb of Minnesota. Seriously, mail is just piled up by the door. This is the official address for a company called Zinc Health Services.
Then you hop across the ocean to Dublin, Ireland, and guess what? It's the exact same story. A reporter gets led to a suite that's supposed to be home to MSR Pharma Services, but inside, nothing. Just fluorescent lights buzzing over rows and rows of empty chairs and deserted cubicles. Nobody's home.
And finally, the third piece of our puzzle is in a Swiss town, one of those places famous for being a tax haven. This company is called Ascent Health Services. Now, this one actually has a few employees, but get this, when a reporter showed up and started asking questions, they called the cops. So you've got three companies, three different countries, and one massive secret.
So what on earth is going on here? How is it even possible that these ghost companies, Zinc, MSR, and Ascent, are somehow among the most profitable businesses in the entire world? How do they rake in over 25 times more revenue per employee than a giant like Apple? To figure that out, we need to meet the middleman.
Okay, so to untangle this whole mess, we have to ask a really basic question. Who actually decides the price you pay for your prescription drugs? The answer is probably not who you think. It isn't your doctor, and it's not really your insurance company either.
The real power player is a type of company called a pharmacy benefit manager, or you'll hear it called a PBM. Now, their original job was pretty straightforward: get millions of patients together under one umbrella and use that collective buying power to negotiate lower drug prices from the big pharma companies.
But here's the thing. That immense power has gotten incredibly concentrated. Today, just three PBMs, CVS Caremark, Optum Rx, and Express Scripts, control a staggering 80% of the entire prescription drug market. And they are owned by some of the biggest healthcare companies in the world: CVS, United Health, and Cigna.
The whole business model for PBMs was built around these payments from drug makers called rebates. In theory, these were just discounts that were supposed to be passed along to lower costs for everybody. But, well, over time, the PBMs started keeping a bigger and bigger slice of that pie for themselves. It stopped being a cost-saving tool and turned into a huge source of profit.
So, as you can imagine, regulators and big clients started getting suspicious of this whole practice. The PBMs needed a new strategy. They couldn't just pocket the rebates so openly anymore, so they came up with a pretty brilliant, and critics would say deeply deceptive, workaround.
They basically created middlemen for the middlemen. Each of the big three PBMs set up a new secretive subsidiary. They call them Group Purchasing Organizations, or GPOs. And yep, you guessed it, these are our ghost companies: Zinc, MSR, and Ascent. The Federal Trade Commission, by the way, has a different name for them. They call them rebate aggregators.
Okay, so here's how the new game works. The PBM can now go to its clients, say your employer, and promise them, hey, we'll pass through 100% of all the rebates we get. Sounds great, right? But here's the catch. The drug maker now makes two payments. There's the rebate, which, sure, gets passed through, and then there's a whole bunch of new administrative fees, which get funneled to that secretive GPO, and that's the money they keep.
As one former health insurance executive put it, this whole new setup creates the perfect loophole. Health plans get all the money they can see back, but they have absolutely no idea that billions of dollars in these so-called fees are being routed through these new secretive companies.
So, just how much money are we really talking about? Well, the investigation managed to uncover financial data in court documents that show the unbelievable scale of this operation.
This chart really puts it all into perspective. I mean, look at this. In 2024, Apple generated about $2.4 million per employee. NVIDIA, the AI chip giant, about $3.6 million. The PBM GPOs, with their handful of staff and empty offices, they generated an estimated $50 million or more per employee. That's not a company, it's a financial pipeline.
Mark Cuban, who's been a really vocal critic of this industry, explained the whole point of the scheme very bluntly to investigators. He says these GPOs are just covers that let the PBMs pretend to be transparent about rebates while they hide billions in all these other fees.
And right here, this is the hard proof. This data comes from a legal settlement where CVS's GPO, Zinc,
had to pay back money to the state of Illinois. Look at this column here, withheld fees. It shows Zinc kept almost $49 million from just one state's health plan over 3 years. Now just try to imagine that number multiplied across thousands of clients all over the country.
You know, this isn't just a story about complicated accounting tricks and hidden fees. These financial games have real and sometimes truly tragic consequences for people who are just trying to get the medicine they need to stay alive.
And this is where these PBM decisions, all driven by who's paying the biggest rebates and fees, become a matter of life and death. Late in 2023, the PBM Optum Rx changed its list of covered drugs. They dropped an affordable asthma inhaler, probably for more expensive ones that generated bigger payments. So in January, a 22-year-old named Cole Schmidknecht went to refill his prescription. He was told the price had shot up from his usual $67 copay to nearly $540. He couldn't afford it. He left the pharmacy without his inhaler. 5 days later, he had a fatal asthma attack.
Cole's father, Bill, just captured the devastating reality of it all. His son's life-saving medicine was suddenly put out of reach because of a decision made in a corporate boardroom hundreds of miles away, all likely to maximize profit.
Cole's story is just a heartbreaking example of what is at stake here. But the secret of these GPOs is finally starting to get out, and now there's a real fight for transparency happening on a bunch of different fronts.
And all of this leads to the most obvious question, right? How can any of this possibly be legal? Well, that's the very question being tested right now in courtrooms and by regulators all across the country.
You've got states filing lawsuits, accusing PBMs and their GPOs of illegally holding on to funds and fixing prices. At the federal level, the FTC is suing the Big Three, and they are specifically calling out these rebate aggregators as a huge problem. And government audits have already forced these companies to give back tens of millions of dollars that they had improperly kept.
So the shell game is being exposed. The empty offices, the hidden fees, it's not a complete secret anymore. But let's be honest, this is a battle against some of the largest and most powerful corporations in the entire world. And that leaves us with one final critical question. In this fight for fair and transparent drug prices, who is actually going to win?